We will now do a brief review of background pertinent to normal vaginal delivery. Labor has 3 stages. The first stage of labor is dilation and corresponds to the time that it takes the cervix to go from being thick and closed to thin and open. Full dilation, signaling the end of the first stage of labor, occurs when the cervix is 10 centimeters dilated. The second stage of labor extends from the complete dilation of the cervix to the delivery of the baby, and the third stage of labor extends from the delivery of the baby to the delivery of the placenta. From an EMS perspective, we are most focused on stages 2 and 3 of labor, and that is what we will be discussing during this course. For the most part, patients in stage 1 of labor require little more other than a ride to the hospital. Normal delivery is known as cephalic or head-first delivery. The movements taken by the baby during delivery are known as the cardinal movements of labor. From an out-of-hospital perspective, the last 4 movements are the most important, as these start with the crowning of the fetal head at the vaginal opening, which is the clinical finding that indicates to EMS clinicians that the baby will be delivered in the field rather than the hospital. It is worthwhile understanding these movements, as they are the foundation for the maneuvers that are employed to assist with normal delivery and also help one to recognize when delivery is complicated. The cardinal movements start with the extension of the fetal head under the pubic symphysis. At this point, EMS clinicians simply must recognize imminent delivery and may provide perineal support. Extension is followed by the turning of the baby's head, called restitution, followed by the delivery of the anterior shoulder using gentle downward traction, and then the posterior shoulder with a gentle upward movement. The rest of the baby's body will follow easily once the shoulders are delivered and concluding the second stage of labor.